Hey.
Hi. How's it going?
Pretty good.
Mr. Monroe, correct?
That's correct.
And this is?
This is Baby Cat.
Baby Cat. Okay, and this is Bruce, right?
Yes.
Okay. It's nice to meet all of you. My name is Dr. Perez. I will be your optometrist today.
Okay.
So I got a referral sent over from your PCP. It looks like you had a cognitive assessment done.
Yes.
Post-concussive syndrome.
Yep.
Okay. And I saw that there were a couple notes about your peripheral vision.
Yes.
Okay. All right. It's very nice to meet you. Thank you for coming into the office.
Sure. Thanks for having me.
Let me just have a look at your chart here. Looks like Bruce went for a little walk. I do have the door closed, so don't worry about that. Okay. So let's see. Can I just confirm a couple pieces of information?
Sure.
Can you tell me your first and last name?
Yep. James Monroe.
Monroe, M-O-N-R-O-E.
Yep, that's correct.
And how old are you?
I am 32 years old.
32. And you're here for a follow-up eye exam.
Yes.
Specifically the peripheral,
peripheral.
vision. And
Yeah.
then I saw something about an overactive eye reaction in
Yes.
was it the right side?
The right eye, yeah.
Okay. I see. All right, well, I'm just going to get a little bit of patient history from you, if that's okay.
Sure.
Can you tell me if you have any family history of eye disease, such as glaucoma?
I do. My grandmother on my mom's side. My mom's mom.
Has glaucoma?
Yes.
What about diabetes?
No.
Okay. Any macular degeneration on either side of your family?
No.
Okay. And as far as your eye history, are you currently experiencing any of the following symptoms? Blurry vision?
No.
Okay. Double vision?
No.
Any floaters or halos?
No.
Okay. I'm not noticing any visible bulging, but have you noticed any bulging of the eyeball itself out of the eye socket?
No, I haven't.
Okay. Any swelling in or around the eye?
No.
Any pain?
No. No pain.
Okay. Can you rate your pain level at this time on a scale of 0 to 10?
0.
Perfect. Any issues with light sensitivity?
No. Well, at night, yes, I can say. If I'm driving, sometimes headlights are brighter than they appear to be.
Okay. So specifically driving and usually at night.
Yes.
Got it. Any issues with dry eyes? Overly dry?
Yes. I do work from home, so I'm on the computer a lot. And by the end of the day, I do have some dryness in my eyes.
So you work from home, so we'll address that here in a second. And any issues with overly watery eyes, teary eyes?
No, I do have some seasonal allergies. So sometimes when I first go outside, there may be a little bit of, runny eyes, but it's not extreme.
Okay. And with that runniness, is it like just tears, like
Yes.
water,
It's
or
tearing.
no discharge or mucus
No,
or any kind
it's
of?
just
Okay.
regular tearing.
Got it. Any issues with redness or red eyes?
No.
Any yellowing of the eyes?
No.
Any difficulty focusing on anything for a long period of time, specifically on the computer or on your phone while you're driving?
No.
Okay. And have you noticed any decline in your visual acuity? That would be like being able to see things, whether it's near or far.
No, not that I know of. I haven't noticed anything.
Any other symptoms you think are notable?
No, none.
Okay. And just to go back to your work-life situation, you said you work from home.
Yes.
And that's on a computer specifically.
Yes, it is.
How many hours a day would you say you look at a screen?
At least 5.
5 on average.
Yes.
Okay. And are you taking breaks in that period of time, whether it's lunch break, 15-minute break, anything that kind of breaks
Yes,
that cycle?
I do take breaks.
Okay, perfect. So ideally, we'd like you to take a break for every hour period, at least 10 minutes. I know
Okay.
that's not always realistic in the work
Right.
setting. If you work from home, it might be a little more flexible, so I would try, if you can,
Okay.
even if you look away for a couple minutes, set a 2-minute timer on your phone, look
Right.
away from the screen, kind of try to look at other things in the room,
Okay.
just to get your focus off of the screen. It does make a difference.
Okay. Yep.
And then what about screen time at night?
Maybe 2 hours. 2 hours at night.
Okay. Do you have an iPhone by chance?
I do.
Okay. If you're not already, I highly recommend turning on the night mode setting. It'll just eliminate some of that blue light.
Right.
Those blue lights are really bad for your eyes, and it also messes up your sleep cycle. So
Okay.
inhibits the production of melatonin. So I do recommend turning on that night mode setting if you have it. Okay.
Okay.
All right. I have mine set on a timer. Comes on every
Yeah.
night at 9 p.m. Just makes it a little easier.
Right.
Okay. So if it's all right with you, I will go ahead and get started with the examination.
Sure.
All right, James. I am going to go ahead and start with our visual inspection.
Okay.
So can you tell me how long you've had this pair of glasses?
3 years now.
Okay, so the last time you had a visit with your optometrist was about 3 years ago?
Yes, it was.
So I'm just going to have a look at your eyes overall for now. Just
Sure.
look straight ahead for me. Just looking for any signs or symptoms of notable facial edema. Anything that could indicate either a blockage in your optic nerves or any sort of swelling that could indicate an infection. Your PCP mentioned there were just a few abnormalities, so basically I'm just ruling out anything that could be more serious than just the post-concussive syndrome, which could be related to the symptoms you were having. So now I'm just checking pupillary reflex, checking for that constriction and dilation of your pupils. Just performing a simple swinging light test. I know this is a little uncomfortable, but you're doing great. Perfect. So I'm going to bring the light up really, really close to your eyes now.
Okay.
So I'm not noting any facial edema.
Okay.
Very, very slight overreaction to the light in the right eye, but nothing that was significant at all.
Okay.
Okay. So let's go ahead and move on. I have a tool here called an ophthalmoscope, and essentially this is going to allow me to look deeper into your eye by shining a very bright light.
Okay.
For this test, I do need you to remove your glasses if you don't mind.
Sure.
Okay, so I'm going to start actually on the unaffected eye.
Okay.
Excuse me while I step in front of you.
Sure.
And if you could just lean towards me, I do need to get fairly close to you here. Just having a look at that cornea. Pupil and iris appear healthy. Can you look away for me? Perfect. Sclera appears normal. I'm just going to gently pull down on your eyelid.
Okay.
Having a look at the conjunctiva, which is normal. Perfect. So I'm going to come around to the affected eye.
Okay.
And because you are having that light sensitivity, it might be slightly uncomfortable on this side, okay?
Right.
Perfect. Just visualizing the optic nerve. Good. And can you look away for me? Okay. Again, gently pulling down. Okay. Can you look towards me for just a second? Okay. So I'm not seeing any abnormalities in your optic nerve,
Okay.
iris, cornea, pupil all appear to be healthy.
Okay, good.
There's definitely not any signs of any kind of structural damage, okay?
Okay, good.
So that's a good thing. That would be our main worry, that there would be some kind of injury to the eye itself.
Right.
Okay. So I I am going to go ahead and put on a pair of gloves. Okay, so as we move on to a more in-depth part of our examination, I am going to listen to your eyes. I know that sounds odd with my stethoscope.
Okay.
And essentially I'm listening for proper blood flow.
Okay.
And essentially I'm listening for proper blood flow.
Okay.
I want to make sure there's no occlusions in your optic arteries. So just go ahead and relax for me. This is going to feel very cold. Starting at the temple. I'll be listening bilaterally, checking for even and symmetrical flow on both sides. Perfect. Now I'm going to go over your eye very gently. Lastly, I'm just going to listen to one of the arteries in your neck that provides blood flow to your eyes. Okay, all of that sounds completely normal.
Okay, good.
Very good blood flow on both sides. So there's definitely not any signs of decreased flow, which is perfect. All right, so why don't we move on to some manual palpations.
Okay.
And essentially that means I'm going to be palpating your face with my fingers. I'll be pressing in some areas, very lightly pinching in some areas, just checking for any signs of abnormality, okay?
Okay. Should I close my eyes or leave
You
them open?
can if you'd like.
Okay.
Some people prefer it. I know it can be a little awkward standing so close to you, so it's completely up to you, but I'm just going to begin by touching your face. And I do want you to let me know if any of this is uncomfortable, painful, or you feel any sort of pressure, okay? So as I palpate around your sinuses, are you feeling any abnormalities here?
No, I don't.
Okay. Do a light pinching motion, and I'm just checking for any signs of abnormal swelling underneath the eye socket. signs of abnormality there. So now I'm just going to very lightly, excuse me while I get a little closer, I'm going to very lightly press on your inner tear duct with my pinkies. Okay. Did you feel any pressure with that?
No, I didn't.
Very good. So no notable orbital edema. Very good. So I do want to do a little more testing with my Penlight. Can I have you look away from me?
Sure.
I'm gonna shine this almost behind your eye. Let's do the opposite side. Do you need a second?
I'm okay.
I know it's a little bit. Very good. So that test essentially allows me to look for the shadow
Okay.
that casts on your eyeball itself, and if it's even, we know that there's not an issue with any eye bulging. So
Okay.
no abnormalities there. Very good. Okay, so the next light test is a little odd.
Okay.
I want you to bring your head forward as much as you can, like this.
Okay.
Good. 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 Okay, all done with that. Again, just checking for that bilateral shadow, and we're good there. All right, James, so let's go ahead and move on to a couple measurements.
Okay.
A lot of these tests are checking for any swelling. Edema can be a symptom of a bigger issue, so we want to rule it out in as many ways as we can.
Okay.
So I'm just going to use my tape here to measure for any abnormalities, any signs of asymmetry in the eye, one eye to the other. As well as your eye spacing in comparison to the rest of your face. And your face is fairly symmetrical. So I'm going to do from your ear to the corner of your eye on both sides. Okay. And again, no signs of abnormality there. So far we're looking okay.
Okay, good.
So why don't we go ahead and move on to a different portion of the exam. Now, your PCP talked to me about the issues with your peripheral vision. Is
Right.
that something that you've noticed on your own time, or
No.
is the first time you've noticed it when you went
Just
to
when I
your
went
doctor?
for the checkup and they went through all the
And
testing.
he saw an abnormality,
Yeah.
or she saw an abnormality there. Okay. So you don't notice while you're driving that you can't see,
No.
you know, on either side, or that you're having to check your mirrors more frequently, or you can't
No.
see someone if they're standing next to you versus in front of you, that kind of thing.
No, I'm a frequent mirror checker, so no, I've never noticed that.
Okay. All right. Well, let's do some tests, probably similar to what they did at your PCP's office, but
Okay.
obviously with the specialist, we're more inclined to note something abnormal. So
Okay.
I have what's called an ocular occluder.
Okay.
And to start, I want you to just cover whichever eye you prefer.
Should I put my glasses on or leave
Let's
them
leave
off?
them off for now.
Okay.
I can hold them for you if
Okay.
you like.
Thank you.
So go ahead and cover one eye for me. And as I stand here, are you able to see me wholly
Yes.
with the one eye?
Yes.
Okay, so can you tell me how many fingers I'm holding up here?
Yes. 2.
And now.
3.
And now.
No, I cannot.
You can't see that.
No.
Here,
No, I can't see it.
here.
Yes. 2. 2. 3.
Okay.
2. 2. 1 and 2.
Okay.
3.
Which side?
My right side.
Okay. So give me just 1 second. As you do that, I am going to occlude one of my eyes as well. So I will occlude the same eye that you have occluded.
Okay.
And now?
Not quite, a little far. Yes,
No?
2.
Okay.
2, 3, 4, 4, 2, 2. Can't see. 3, 5.
Okay. Let's go ahead and switch eyes. Same thing.
Okay, 2, 3, 4, 5. 2, 4, 4, 5. 2, 2, 3. Can't see. 3, 5.
Okay. So you definitely got a few more correct on that side than you did the other. So I
Okay.
did notice a very slight difference there. Okay. So this time I want to perform that test again, but I'm going to put this perforation down so you'll be able to see even less
Okay.
out of the eye that's not occluded. So with that, can you see all of me still?
Yes.
Okay. Can you tell me how many fingers I have up now?
5, 2, can't see. 1, can't see. 3, 4, 2, can't see. 2, can't see. 1,
Go ahead and switch for me.
okay.
Same thing.
2, I think, is just out of frame. 1, 2, 3, 1. Can't quite see, but I think it's 4.
Very good.
1, 2, 2, 1, 3.
Very good. Okay. So there's definitely a slight difference on the
Okay.
right side. Okay. Interesting. I will take this from you for now.
Okay.
So for this portion of the exam, I want you to go ahead and put your glasses back on. And you said you feel like your visual acuity has not declined, so
Right.
hypothetically you're saying okay with the
Mhm.
glasses that you have currently.
That's correct.
Okay. So I have an acuity card here, and it's just a card with a bunch of letters on it.
Okay.
So I want you to try to tell me what these letters are, okay? So the very first one here,
E, L, T, F, P, H, O, L, C, F, D, H, J, B, S, E, P, T, Z, O, C, F, D, H, J, L, T, F, L, T, F, P, H.
very good, okay. So now can I have you occlude either eye with your hand? And can you read that smallest line?
Yes, L, T, F, P, H.
And this line here?
D, H, J, B, S.
And what color is this?
That's red.
And what number is this?
4. I'm sorry, 6.
Very good. Switch eyes for me.
Mm-hmm.
Can you read this line?
F, P, H.
Very good. And this here?
E, P, T, Z, O.
And the smallest line you can see.
L, T, F, P, H.
Very good. And this color here?
Green.
This number?
4.
Very good. Okay. So your visual acuity is mostly intact.
Okay.
Very good. So I'm not suspecting that your glasses are too out of date, maybe
Right.
slightly.
Maybe slightly, yes.
Okay. So before we address that, I want to move on to a sensation test. Now this test is mainly to rule out any of those cranial nerve deficits that we talked about in the beginning of the test.
Okay.
I know that your primary care doctor did do a cranial nerve exam with you where he
Right.
performed sensation exams,
Mhm.
correct, around your face?
Yep.
Okay. And I didn't see anything notable with that, but I would like to repeat the test on a
Okay.
minor scale here just to make sure he didn't miss anything, or
Sure.
he or she.
Sure.
Okay. So I have a couple different things to test here. Let's start with something very soft. Okay. So So I'm going to test this on your hand if that's all right. Can you feel that?
Yes, I can.
Okay. Can I have you close your eyes for me? So I want you to just say yes when you feel it, okay?
Okay. Yes. 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 Yes.
Okay, and any difference here and here?
No.
Here and here?
No.
Good. So I'm going to test that again with, can you feel that?
Yes, I can.
Okay. So same thing, say yes if you feel it.
Yes. 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 Yes.
Any difference here and here?
No, there's not.
Okay. Can you feel this?
Yes, I
Can
can.
you tell that this is sharp?
Yes, I can.
Okay. So we're going to do soft or sharp, and I want you to verbalize which one you feel.
Okay. Sharp. Soft. Sharp. Sharp. Soft. Sharp. Soft. Soft. Sharp. Sharp. Soft. 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 Sharp. 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 Soft. Soft.
Very good. Okay, so no abnormalities with that. And while I have this tool out, I'm going to use it to test your corneal reflex.
Okay.
So I'm just going to be using this to touch the corner of your eye, okay?
Alright.
Open wide for me. Don't hold them open, but just one more time. Okay. Is that uncomfortable on the right side?
Somewhat.
More so than the left?
It just feels more sensitive.
Okay, so there is a slight overreaction on this side.
Mm-hmm.
It also is slightly wet now, so your eye is tearing a little more on this side
Okay.
than on the other side.
Okay.
Just have a look. Okay. Alrighty, well let's go ahead and move on. I have another portion of the sensation exam here, and this is probably mildly uncomfortable. I'm going to be blowing a couple puffs of air in each eye, okay?
Okay.
So I want you to just look straight ahead for me. You don't have to close your eyes. Okay. So again, slight overreaction on that right eye. I'm going to give your eyes a second,
Thank you.
of course. And let me know when you're ready, no rush. So I have a couple different tools here, and this time I'm going to label them as number 1 or number 2.
Okay.
So this is number 1.
Okay.
So pretty obvious. It's very smooth, cold metal.
Right.
This is a not so smooth, cold metal.
Okay.
So this will be number 2.
All right.
Can you tell the difference between this and this?
Yes, I can.
Okay. So I want you to tell me if you feel number 1 or number 2, okay?
Okay. Number 2. Number 2. Number 1. 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 Number 1. Number 1.
Okay, very good. So your sensation exam is essentially normal. I didn't notice any abnormal reaction as far as getting any of them incorrect.
Okay.
Again, that overreaction on the right side, I would guess, is due to some underlying sensitivity that you're having in that eye.
Mm-hmm.
It doesn't necessarily have to be pain. Tenderness could cause that as well.
Okay.
Okay. So for the next portion of the exam, I'm going to be testing another portion of your corneal reflex. So essentially, I'm just testing the reflexes of your eye. So this
Okay.
isn't a sensation test, but I will be touching something to your face, okay?
All right.
So can I have you remove your glasses for me? Okay. So you can keep your eyes open. Don't force them open. Blink as you feel you need to, okay?
All right.
brush over your eyeball, but some of these are going to get very close. Okay. There is a very slight notable difference on that right side. Did you feel any different on either side?
I did. I could feel my eye kind of flatter a little bit as you were getting close to it on the right side.
And do you ever notice any eye twitching or anything like that?
No.
Okay. All right, so let's go ahead and move on. I want you to tell me, this is a sensation test, but you can keep your eyes open. I want you to tell me if you feel that this is cold.
Yes.
In here?
Yes.
Any difference in the way this feels cold versus the way this feels cold?
No, it feels the same.
Same coldness here and here.
Yes.
Does that feel colder?
No. 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 Nope.
Okay.
Yeah, that feels colder.
Colder here?
Yes. Yeah.
Colder there?
Mm-hmm.
Same coldness here and here?
Yes.
Okay, very good. So no abnormalities with that. And actually, tell me if you feel vibration here.
Very slightly.
But you do feel it. In here?
Yes.
More so than the other side or the same?
About the same.
Feel that?
Mm-hmm. Yeah, same.
Very good. All right, so now I am going to do some percussions of the eye. You are welcome to either close your eyes or keep them open.
Okay.
I'm going to move to this side to start. Hello, Bruce. Excuse me. Okay. I'm just checking for any irregularities in your orbital bone. So your actual eye socket here is protected by a bone, and I just want to check for any structural damage. Any pain, tenderness,
No.
tingling, burning?
No.
Okay. Can you look up for me? And look down. Very good. Okay. All right, let's go ahead and have a look on this side. So same thing, just let me know if you feel any tingling or numbness, burning, itching, anything other than just normal percussing on your face. Look up for me. And look down. Okay. I did notice some distinction there. It seems like we're mostly having issues with peripheral vision, lack, I wouldn't say so much loss, because you did get some correct, and there is definitely an oversensitivity of the right eye.
Yes.
Okay. So I would like to move on to a different part of the examination, and what I would like to do now is get you fitted for a new lens. I do suspect that your current lens is just slightly out of date.
Okay.
So the lens that I have here is just about where your current glasses are at.
Okay.
So I'd like you to put these on for me,
Okay.
just as you would normal glasses. And if you look straight through those, does that feel right at about where you currently are?
Yeah, it does actually.
Okay.
Yes.
So if I bring out my Acuity card, are you able to see that top letter?
E.
And here and here?
LT.
Here, here, here.
FPH.
And here, here, here.
DHJBS.
And the lowest line you can read there.
LTFPH.
Very good. Okay. So, do want to go up. So let's try. This might be an overcompensation, but let's try this because we can always scale back.
Okay. Blurry.
Too much.
Yeah.
Okay. Just to be sure, can you show me the lowest line here that you can see?
FPH. OL. That's hard to see.
Okay, so definitely an overcompensation there. Good. And if we do here.
Still not as good as the first one.
Okay. Lowest line here.
DHJBS.
Okay. Now, if these are a 1, and this is 2, which would you say? 1?
2 for sure.
2 for sure.
Yes.
Okay. So now if this is our 1, I'm going to hold this up here, smallest line.
L, F, something, PH.
Perfect. And 2.
LTFPH.
Very good. Okay. So that is definitely your new prescription.
Okay.
The good news is you are only 1 level up from where you were before.
Okay, good.
So I will get that sent over to the lab so they can get that manufactured for you.
Okay.
And if I had a pair of prop glasses here for you to try, these are pretty similar to the style that you currently have.
Okay.
So I want you to try these on for me and let me know if this is something similar to what you would be looking for. If not, I can bring you some other models.
Okay. No, they are pretty similar.
Very similar, maybe
Yeah.
slightly bigger, wider.
I like them.
You do?
Yes.
Okay. And okay, I just have a mirror here that I'd like you to look in.
Okay. Yes. I like them.
You like them?
Yes.
Okay. And this one is more from another person's perspective.
Okay.
Now, are you happy with those, or would you like to see a different pair?
I like these.
Okay. So we will go ahead and get those fitted for you. Let me just take a couple of measurements here. Do you feel like they're too big anywhere or too small anywhere? Do we need to adjust them at all?
No, I actually think they're okay. They don't really move too much.
Okay. So I'm just gonna mark pupil center, so I can have you just look directly at my nose. Right in about, let's do 1 1/8, and you're at about 1 there. Okay, so right side, we'll do 1 1/8, and then left side, you're right at about 1. Okay, so we will get that taken care of for you. So I'll go ahead and remove these. We will have those sent over to the lab. You're welcome to put your other glasses on at this time if you'd like.
Okay.
Now, are there any sort of protective lens coatings that you'd like to add? Are you partial to
Yeah.
transition lens? I always recommend my patients at the very least, do the scratch resistant coating.
Scratch resistant. We can do UV.
Okay.
I don't want transitions.
Okay.
Yeah, just the scratch and the UV
Perfect.
works for me.
Okay. And your glasses currently do have a thinner set on them because your prescription is what I would say is greater than the normal.
Okay.
And you do have astigmatism in your right eye currently.
Right.
So do you want the upgraded version, which would be a thinner glass like you have now?
Yeah.
Okay.
Please.
So we'll level up 1.
Okay.
Okay. So I will get that taken care of for you.
Cool.
And with that, let me go ahead and give you your case now.
Okay.
So this will be your case for your new glasses as well as the white cloth that is in here.
Okay.
Highly recommend using this. You don't want to use any other sort of t-shirt or cloth to clean your glasses unless it's a glass cleaning lens, okay?
All right.
So you can take that home today.
Okay.
Your glasses should be ready by tomorrow morning.
Okay.
With that, I also want to send you home with some of those lens towelettes so you can use these to clean your glasses safely. These are individually packaged, so I'll send you home with a couple of those, okay?
All right.
And then, of course, just a bag for you to put that in.
Okay.
So I'll have you hold on to that. And
Thank
then
you.
the last thing that I want to send you home with, of course, okay, so let me go ahead and write your prescription in here.
Thank you.
Of course. So these are going to be for full-time wear. And you do not have prescription sunglasses. And we're going to have you down as... I'm writing on here 5-hour wear minimum, so if for whatever reason you decide not to wear them throughout the day, do wear them at least while you're using the computer, okay?
Sure. Okay.
Okay. Next exam date would obviously be 1 year from today, unless you're having any other abnormal reaction.
Okay.
And of course, Mr. Monroe. Okay. So I will send you home with this. Go ahead and put that in your bag. I am going to send these notes over to your PCP so that she knows her findings are correct.
Okay.
And we'll see kind of where to go from there. The next
Right.
step would be to send you to a neurologist.
Yeah.
So neurologists would specialize in looking further into the eye itself, possibly doing an MRI, maybe a CT scan to check for any internal edema that we're not able to visualize.
Okay.
It could possibly be that these symptoms are just secondary to the post-concussive syndrome.
Right.
And unfortunately, it may go away with time, it may not.
Right.
If you feel like your symptoms are increasing, we obviously want you to come back in, but we're likely going to have you end up going to see a neurologist, okay?
All right.
Just to rule out anything that could be more serious.
Okay. I understand.
All right. So tomorrow morning, I will have the receptionist give you a call when your glasses are ready. You can come pick them up then, okay?
All right. Sounds
All right.
good. Yep.
Thank you so much, James. It was so nice to meet you.
Okay. Thank you so
I
much.
hope you get home safely.
All right.
All right.
Bye.
Thank you.